experienced speakers have spoken, and we brought in some member organisations from the Southeast. I will be opening up this meeting to the local elected representatives for them to comment. This meeting has been recorded and will be available afterwards on our social media channels. So I'm going to turn now to Bernadette Myler-Driscoll from County Waterford, and she is going to talk about her experience as a family carer and the difference having a community neuro-rehabilitation team would make to people throughout the Southeast. I'll hand over to yourself, Bernadette.
Thanks, Mags. Good morning, everybody. As Mags said, I'm based in Waterford. My name is Bernadette and I'm a carer, and I have been for over 15 years. Whether it's you want to be a carer or not, sometimes you find you are. And I was looking after my mother who has Parkinson's disease. She is now in a nursing home, but obviously I'm still her carer and responsible for her. And I look after my husband who has Alzheimer's. I have been involved in the Parkinson's charity for over 20 years, which the club itself and the support group we have in Waterford and Kilkenny was set up originally by my mum, but I run it and I set the Kilkenny club up about 5 years ago. We did that because there was a huge gap from being somebody that received a diagnosis and how you then supported. Can everybody hear me? There's a terrible back echo there. Can you hear everyone hear me okay?
Bernadette, just if I can ask everyone to go on mute unless they're speaking.
So we had to set something up because there was a huge gap from having a diagnosis from your neurologist to, okay, what do I do now? I've got this life-changing piece of news, and what support is out there. Things have evolved slightly, but we still obviously have a need because I set up the club in Kilkenny 5 years ago. And there is an enormous gap between either a GP neurological diagnosis, because some people only get to see a GP, and thereafter there sort of is this huge chasm. And it's, as an individual, I've gone out and tried to find the strands to try to get support, whether it's for people suffering from Parkinson's. A number of people used to come to club that had MS, and in the case of my husband, Alzheimer's. The reason I'm involved in what we're doing today is that I am fully aware of the gaps, of the real need for support. And that support should not be dictated by your age, which it is down here. There is some support in Waterford, but you need to be over 65 to avail of it, or your location. And I think the real issue in all of this is an ability to tap in to expertise that's medical, not just depend on volunteers, which is what I am, and my ability to connect with people and try to bring help in. But we need something to assist in maintaining people's level, because when you get diagnosed, you're at a certain level and you want to stop, if at all possible, the speed of any degradation, if it's feasible. And you don't know that unless you have people that you can go and see. To assist people to have a mental health check immediately, because your mental health suffers the moment you get a diagnosis like that, not just you as the person getting the diagnosis, but your family, the people around you. All of a sudden, somebody who's a carer, who's not trained, who has no experience, who just has this massive life-changing experience they've got to deal with no support to try to deal with that. And as I said, we're doing that as volunteers. A volunteer, me, I'm running it, and I'm trying to get people to help. Not always easy. And then you're dealing with people who are unwell. So you're trying your best to give them some form of support. And it's really not good enough. It's great to have it. I'm sure everybody appreciates it. But as I said, we need to have a maintenance. And I've made a note here. We need intervention quickly. We need somebody to come in and help so that people's speech doesn't deteriorate so quickly, because they have got speech therapy or they've got physiotherapy, so that their walking and their balance can be addressed. And people's quality of life will be changed dramatically if we have this team that have the speciality and the experience to come in and help. My own personal experience has been really 20 years more or less of understanding the impact it has on so many different people, and a deep feeling of frustration of, we need the help. I'm here, I can only do so much. You constantly feel you're not doing enough, you feel inadequate, you're trying your very best, but you've got to do what you have to do in terms of being a carer, and you've got to go to work. So it's really, I think now, 21st century, there are funds there. We don't need just the funding. We need a commitment to recruit the people, and we need a commitment for what time, what date, what year is that going to be? We don't want funding in 6 years, we still don't have anybody. We need this, we need it now. This area needs it desperately. We're talking about Waterford and surrounds being a place to live that's healthy, to bring your family up, etc. And it is, but people matter. If you're ill, you matter just as much as everybody else. And if we're going to be somebody as a county, as counties, as a region that are professing healthy life, that means looking after that life as you go on, whether you have neurological issues or not. And if you have neurological issues, they need to be supported. I can't stress enough how desperately we need action, and we need it now. Thank you.
Thank you so much, Bernadette. And as we just said at the opening of this meeting, this is a real case of geographic inequity, where these teams are coming on board in other parts of the country. There are 4 teams going to be established around the country in 2025 in other areas, in Cork, in Galway, in the east of the country, and the southeast is being left behind. And I'd say we're calling for this to be addressed in this year's budget. This team has been promised since 2019. I'm going to go to Tom now, Tom Nolan from Wexford, and Tom is going to talk about his experience of stroke and the difference that having a community neurorehabilitation team would make for him and the likes of other people in Wexford living with a neurological condition. I'll hand over to you, Tom.
Thank you. My name is Tom Nolan. I'm a stroke survivor. I'd just like to give you a little bit of background information about myself. I'm married down here in Wexford. I'm 54 now. In my career, I was a civil servant in the financial services sector. I had long commutes to work. It was an office environment, and I had little time to exercise. So I had a stressful work environment, long days, 12-hour days, and little exercise. So I was overweight, and which contributed to me having a high blood pressure, which caused my stroke. When I didn't realize I had high blood pressure. So I had a stroke 2 years ago, and I was paralyzed. It was a bleed on the brain. I was paralyzed down my left side. I couldn't walk, couldn't move my arm. I couldn't talk. My vision was affected. My ability to eat was affected. I was eating only fluids. My esophagus got affected in the stroke, and my heart got affected. So I was in a bad way when I got the stroke initially. So the initial stage, I say, when I went into the hospital first, I was dealing with a lot of shock, fatigue, major fatigue from the stroke, and I was on heavy sedation. So the first few days, I don't remember a whole lot. But when I did start to become aware of my predicament, I realized that, well, I was in total shock, but I also had I was very fearful of where things were going to go for me in the future. My life had been ripped apart in a split second because of the stroke, and I didn't know where I was going to go from here. So I was very fearful. I was very ashamed because I couldn't use the bathroom facilities on my own, so I needed help with everything, even eating. And I felt a lot of guilt because my partner, I felt there was going to be a lot of responsibility on her shoulders for the next number of years looking after me. So I became very depressed, and I had a lot of suicidal thoughts. So I was thinking up what way I could end it, because I didn't want to carry on not being able to do anything for myself for the rest of my life. So I was in a very precarious place. And so I was in the hospital for 5 weeks with no mental health supports. I was in the hospital for 5 weeks, and I had very little physio, maybe 15 minutes a day, it really isn't enough. But that's all I got. So I was then transferred to St. John's in Enniscorthy for rehabilitation. As I said, with no mental health supports, I had a bit of a meltdown in St. John's because the noise and the fatigue I was experiencing, the chronic fatigue, I had a bit of a meltdown, and the nurse told me that I'd have to see a psychiatrist, and I was more than happy because I knew I wasn't, that I wasn't capable of getting through this on my own. So, but the problem was, in a few weeks when I asked why I hadn't seen a psychiatrist, I was told because I was under the age of 60, I would have to go through my doctor and go on a waiting list to see a mental health specialist, and that never. I never, even though I was in a hospital setting at that stage, I didn't have the facilities available. Again, I was in St. John's for 5 weeks, and I was, but it really turned around St. John's. The peer support and talking to my fellow patients gave me a lot of hope, because I seen stroke patients that had got somewhat better. They were able to walk and they were able to talk and do different things, and I gave me some hope. So I decided to push on and give it all I could give to try and get as good as I could get. So I did that, and I left St. John's walking after 5 weeks. So I was delighted with that. As I said, again, very limited physiotherapy. I might get half an hour in the morning, but mainly directional, use this machine, use that machine. Hands-on physiotherapy really seems to be gone now. I don't know. It's not really a thing anymore. But anyway, I left St. John's when I did. I had to be assessed for being capable of getting by in the home. So we needed OT assessment, and we had to do self-assess because nobody would come out to do the assessment on the OT services. So we felt we needed some home care, which was refused. We felt we needed a high-low bed for my mobility issues, which was refused. We felt we needed an orthopedic chair, which was refused. And we felt we needed, oh God, it was one other thing. I'm sorry, my memory is a little bit still affected. Anyway, we didn't really get any services. So I left, I came home, and there was no referral from St. John's for me to have further physio. So I had very little movement in my arm at all. So just barely moving it. And I wasn't referred to for any physio, any extra physio. So I had been put on a waiting list after the hospital for the NRH in Dublin. And I was lucky to get a last minute cancellation after about 4 months. So I was only home 4 or 5 weeks when I got called up for the NRH, and last minute cancellation. And I went up. And this, I have to say, this facility is second to none. I spent 6 weeks in NRH. It's the ground up multidisciplinary thinking is brilliant, and you're included in all the decision making, which I didn't find that was happening before. There was a schedule, and you really to make the most of the physiotherapy and every other facility. I got the mental health support I needed. It is second to none. So I spent 6 weeks up there. Although I have to say, when I was up there, in that 6 week period, I had 6 different physios. Now it seems to be an issue going forward that they're struggling to keep physio staff. So I'm not sure about that. But anyway, so I left and came home, and I was referred for more physio. And at this stage, I could move my hand a little bit, which I was working on that, which is great. So it was a process, and I was getting better all the time. And mainly a lot through my own effort and peer support, but it is important. And so I came home and I was referred for physio, and I was 4 months before I got any physio. And when I got some physio, then I got 3 sessions. 2 assessments were just they were assessing my ability, so there was no direction in them assessments. They were only fact-finding sessions, and the last session was really only a directional session. Go on this website, do this exercise, go on that website, do that. So there was no hands-on, and that was my 3 sessions. And then I was just taken off the books for physio. And to be honest with you, I feel I still need physio. It's an ongoing process. I think I should be still getting it. But look, I've been taken off everything now. So now I was referred when I left the NRH to the ABI, the Acquired Brain Injury Ireland, which I attend every Thursday for wood carving. And I have to say that's a lifeline for me, because I live somewhat isolated and I have no connection with the community. So this is my my connection. I'm able to establish that still with the people, and I feel a sense of worth when I can go in and make something with my hands again, and and to have the peer support from the other clients in the services is brilliant. And people, like-minded people who have had a brain injury like myself. So I find that really beneficial. I say I'm home now. It's 2 years since I had my stroke. I'm home a year and a half out of hospital services, and nobody calls to see me. I don't have any physio. I don't have a community nurse came after the first year and once, and I never seen anyone after that. So it's like nobody cares, and like you're just left to get on with it. And it is quite difficult because my partner works full time. She's a nurse. She does 12-hour shifts, and I'm here and I'm struggling. And you feel I've given my life to public service, and I feel that when I needed some public service, I was left behind, and it's quite sad. But I think this is such a beneficial. This Neurological Alliance of Ireland will be amazing for people who leave services and then have something to call on, for help, and for and not to be lost and to be left, because people are falling between the cracks, and it's quite sad. All I will just finish with saying is, I was in the NRH and I was with people in their 20s, 30s, 40s, 50s, 60s. So stroke isn't related to age, it isn't related to condition or gender. This can happen to anyone at any time. It could be any of you, anytime. And God help, it could be some of your family members. And you'll want the best care for them. And unfortunately, the best care isn't there. I would love to see a dedicated stroke unit in the hospital, a dedicated stroke unit in St. John's, with specialized trained staff. I would love to see follow-up physio care and more intensive physio care at the early onset stages of stroke, because you're getting 10, 15 minutes a day. That really isn't sufficient. You know what I mean? You need, and it's not till I got to the NRH that I got the more specific, dedicated physio.
And
which was
as you say, Tom, that there's such a need for when you come back at a hospital to have that wraparound service. Tom, thank you so much for that. You've given a really clear picture of the need. As you say, that this is something that it is taken for granted. It's available in other areas of the country, and it critically needs to be established. This team, community neuro-rehabilitation team in the Southeast. I'm just going to bring in some of the NEI member organisations locally that work locally throughout the Southeast, and they're just going to talk about the need for a community neuro-rehabilitation team and how that's essential to support the services that they provide locally. I'll bring you in there, Natasha, from Acquired Brain Injury Ireland, and then I'll bring in our local NEI member organisations, as I say, and then give the elected representatives a chance to come in as well. So I'm going to hand over to you, Natasha.
Thank you. Thanks, Tommy. Tommy is a fantastic advocate for all brain injury survivors. Fantastic. Thank you, Tommy. And Mike, thank you for the opportunity to speak with you today about the importance of the community neuro-rehabilitation teams and what that would look like on the ground in the Southeast for our clients in Acquired Brain Injury Ireland. As we know, every year individuals across Ireland experience life-changing brain injuries, and the journey of recovery, it's long and complex and unique to every person. And while hospitals do an incredible job during the acute phase, the reality is that the true recovery begins when the person returns home. The real challenge we see is the gap in continuous rehabilitation, which is crucial time after hospital discharge, when individuals are back home but are not yet connected to the next stage of their recovery. And we all know that investment in the CNRT is essential. They provide that continuity of care that's so often missing, and they would help people reintegrate back into their daily lives and manage emotional well-being and regain their independence, because that's the goal for nearly every person that we meet. And also rehab, it cannot be rushed because that's not realistic, as there's no time on rehab. Every brain injury is different and every recovery journey takes its own time. We've attended many assessments where the main concern is that the individual will regress because the rehab isn't there when they need it. At the moment, I'm currently supporting an individual who needs to travel outside of their county to receive speech and language as an outpatient service, as there's no SLT in their area. And as well, while many receive some psychological supports in hospital, it often stops as soon as they're discharged, which is right when the grieving begins and right when the person and their family start to understand what's been lost. And that's even what Tommy spoke about there as well. And families, they carry so much of that burden, and they're adjusting to changes in behaviour and memory, personality, and that's emotionally exhausting. So by the CNRTs being involved, they would not only support individuals, but also walk alongside the family, offering education and emotional support, and sometimes just a listening ear. So for South East, we need to see rehab for what it really is, a long-term person-centred journey, and not something that ends when the hospital stay is over. And that's because no one's rehab should stop just because they've gone home. Thanks.
Thank you so much, Natasha. I'm just going to invite any other NAI member organisations that are providing service locally if they want to come in. Do people just want to raise their hands? Just don't see any hands there unless I'll just, Eamon, do you want to come in there?
Thanks, Mags. Yeah, I'll just come in just for a little while. So for those that don't know me, my name is Eamon McPartlan, and I'm the founder of F&D Ireland that supports people with functional neurological disorder, a condition I live with myself. I'm also a board member on the NAI, so I suppose I'm just giving my little input here from the two sides. And I suppose just in relation to what Tom and Bernadette said, it resonates with so many people living with neurological conditions. And I suppose just the important thing just to highlight again, and this is so, I suppose, prevalent with those with F&D, is that many people with neurological conditions can get them at a young age. And I get very frustrated when I meet so many young people in their 20s with F&D who can't get access to any support services in their area. And unfortunately, unlike some of the other neurological conditions, those with F&D, we don't yet have a specialist F&D clinic in the country. So we have no access unless we travel to the UK to get treatment for F&D. And I suppose just in relation to peer support, which is mentioned there, it's crucial. And just to share, which people that I've talked to have given me permission to share, just a little bit of the challenge that was mentioned in relation to, I suppose, the postcode lottery of those that have access to community neuro-rehab teams. And I suppose one good example would be Tipperary, which basically is split north and south in the old CHO areas, but also in the new healthcare areas. So we would have members from Tipperary attend our peer support meeting in Mallow, where one person would have got access to the team in Limerick because they live just across the right side of the border in the same county, and another person in South Tipperary, because they're in the southeast area, have no access to a team at all. And this is extremely frustrating, to have that postcode lottery. And that's replicated, as Mags has mentioned, in all these areas around the country that still doesn't have a neuro-rehabilitation team. And just one other final point, just to note, which Tom in particular highlighted there, the importance of access to psychological support for those that live with neurological conditions. And this is a massive challenge for those that live with all neurological conditions, but I especially point out for those with F&D, particularly people who acquire the condition at a very young age. And these are people in college, in their early 20s and work. And again, there's a lot, I'm not saying a lot of supports, but there's some supports in the mental health service if you're under 18 in CAMS, or if you're over 60 in what we call the support in later life mental health services. But to access the mental health services in between is extremely challenging, because many times people that live with a neurological condition don't fit the criteria to have a mental health condition, if I put that in brackets. They need psychological support. So these neuro-rehabilitation teams, the neuropsychological support will be massive. But as Tom mentioned there, and others, the multidisciplinary approach is crucial, because Tom mentioned there, even in several settings that you may have, you come back to the community, you may be fortunate to get a physio that helps you, then you're searching for someone in speech and language yourself that might help you. So by having the team, these are all coordinated. And like if you look at the geography of the area of the southeast, it's a relatively large area. So it's very important that people have access locally to the team. And I think just another important thing just to point out as well, and again, the speakers mentioned as well, is the importance of support for families that live with someone with neurological condition, because this is something that's come up in relation to those that live with FND, and it could be a young mum that might be in her 30s, and the lack of support for her kids in relation to that psychological support as well, because it's very difficult for a teenager to see a mum that has developed sudden onset FND, or it could be stroke or whenever a sudden onset condition, and you know how they are completely changed as a person. So we've got so much work to do, but I think Mags and the team at NAI, and hopefully with all the elected representative members here, that we can get that team in place in the Southeast. Thanks.
Thank you so much, Eamon. You've made a really good point about the inequity that people in the South Tipperary can access the Midwest team, but other parts of the Southeast still don't have their community neuro-rehabilitation team. So we're seeing that geographic divide going on and on since 2019 when this team was promised. I'll bring in Deirdre there from MS Ireland locally.
Thanks, Mags. I'm Deirdre. I'm one of the community workers in the Southeast for MS Ireland. There's 3 of us that cover the Southeast, and I suppose we're unique in that we have community workers. I know the likes of Parkinson's and acquired brain injury don't have our service, but our difficulty, I suppose, is similar to what people have outlined there. We're trying to cobble together services where we're trying to refer people. Like listening to Tom, you'd be exhausted trying to get a referral to primary care physio, then you're looking for a referral to primary care OT, and then speech and language if you're lucky enough. And again, we have very young people between the ages of 20 and 40 is the primary diagnosis for us. So you're trying to support people to stay in work, to stay in education, to have meaningful lives, to have a value, because they still do and still want to. But that sense of you get a diagnosis and then you're just left to manage that yourself is really difficult. So similar to what Eamon was saying, if we could have those wraparound services really early on for people, it'd make a huge difference in terms of the long-term picture for families and for people diagnosed. Any of the physio offerings that we have as an organisation, they're fundraised for. So we've got local branches that are made up of people with MS that are fundraising to provide physio. We have issues with getting physios for in-person. We've got a lot of online classes, and neuropsychology just doesn't exist. We had a talk recently where Dr. Sarah Casey came from St. Vincent's, an amazing neuropsychologist, explained all of the things that she could potentially provide to people, but people in the Southeast can't avail of that. And it is a really specialised service. You're referring people to psychology, hoping that the psychologist is going to understand a neurological condition and what it's like to live with it. And that's a bit hit and miss. And I suppose just on a kind of a human level, I'm looking forward to the day where we don't have to come on like this, where the likes of Tom and Bernadette don't have to show their most vulnerable sides to beg for a service. The people we support deserve a lot better than what they're getting. And you kind of get a little bit tired of firefighting and trying to cobble services together. And I can see lots of people nodding in the group. Our people across whatever organisation you're in deserve a lot better than this. And I couldn't, you know, even the piece around NRH and being out of area for 6 weeks, like for some people, that's a huge deal. For family to have to travel to Dublin, for the person themselves to have to travel to Dublin. Like, I can't say it any other way. Our people deserve a lot better than what they're getting.
Thank you so much, Deirdre. And that's a really, really important point. The Southeast is being left behind. Other areas of the country are getting these community neuro-rehabilitation teams. I just put in the chat earlier, there are 4 teams coming on board in other areas of the country in 2025, but the Southeast still has not got off the starting blocks. It still hasn't got funding for a community neuro-rehabilitation team. Just before I bring in some of our elected representatives to comment, I'm just going to go to Christina in Chronic Pain Ireland, because I know you've been trying to get in there, Christina.
Yeah, I'll keep it brief. Thank you, Mags, because a lot of the points I wanted to raise have been raised by the other speakers, and thank you for that. What I want to say is that we represent a lot of people that not only have neurological conditions, but also have chronic pain, either as a consequence or as a condition in its own right. So many of those that we represent, you know, like say people that would have trigeminal neuralgia, migraine, fibromyalgia, some of them would have hidden spinal injuries, to name but a few, you know, and the issue that they have as well on top of their condition, which impacts every single aspect of their life, the person that they thought they were going to be, the life that they thought they were going to have, and their reliance on care from family and from friends, and the increasing isolation sometimes when people don't get it, you know, that don't understand, and they get really isolated with impacts on mental health. And what we find is that they're often passed between specialists, like, you know, so there obviously neurology is required, like, do you know what I mean? They may need also, like, you know, pain services, and they may need mental health services also. But a lot of the time they're referred back to the GP, like, which is just a longer and longer process. Like, so people are left years on waiting lists, you know, and it's just not inefficient. It delays care, it worsens outcomes. And we know, like, you know, that in a fully resourced neuro-rehabilitation team will change all of this, because they provide joined up patient care, patient-centered care. So we're integrating neurology, pain management, physiotherapy, occupational therapy, neuropsychology, and social work. And that's exactly the kind of interdisciplinary support that improves the outcomes, it prevents hospital readmissions, and reduces long-term disability. And we know that this works because in the UK, neuro-rehabilitation has been shown to reduce hospital stays by up to 26%. And in Scandinavian countries, early rehab intervention leads to significantly improved return to work rates and lower long-term care costs. So it's really unacceptable in this day and age that people in the Southwest continue to experience inequality, particularly in respect to their healthcare provision.
Thank you so much, Christina. Now, I know a number of our elected representatives just had to leave as time is going on. So I might offer, just at this point, I might offer Deputy Noonan and Deputy Mythen if they want to come in and just make a comment or join the meeting.
Thanks very much, and thanks, Senator Malcolm Noonan here. Just to thank everyone for the presentations this morning. And again, given that this promise was made in 2019 and this wasn't addressed during our term in government either, which we have to take responsibility.
I think Senator Noonan might have frozen there. Deputy Mythen, do you want to come in just and we can come back to him?
Yeah, look at thanks very much for the presentation. Look at I've met Tom before and you know Bernard and him. Look at it's
information from this morning to try and
sometimes like
pre-budget
these things are you know that they should be in place and they're not, and we can all talk. You all seem to quite, and we meet groups every day in the week like yourselves, and as I said, it was promised in 2019 and it hasn't been delivered. I don't think it's, as Malcolm just heard a little bit of Malcolm's thing, I don't think like Malcolm, no, it's kind of, you can't blame kind of one person and say that's kind of, or whatever. It's a collective thing with the government, and it's really about pressure. And, you know, being come from the Southeast myself, I mean, we are inclined to be neglected a bit, because what happens with politics is that it's very often centered around cities like, you know, you have Cork and you have Dublin, and it's very difficult to get anything through. But having said that, like as Tom said, like stroke can happen at anybody, anytime, anywhere. And what's actually disturbing a little bit is there's kind of if you like, there's a category of ages. If you're over 60, you have to be over 60 to get such a thing. To that, I mean, that is alone is just as the last person spoke about inequality. How can that be? How can that be like that built into anything, a system like that? The system's wrong. It's very wrong when it does that. Like, sure, like it just doesn't make sense whatsoever. But look at all I can say is that, like Malcolm and myself, like we will advocate strongly. I mean, especially as I said, if there's 4 different things happening at the moment, and Southeast is being left out. I mean, you have to ask the reason why, or what's the reason, and it's a necessity. It's a necessity for people, because you spoke about, you know, Tipperary and North Tipperary and South Tipperary, and you imagine I presume you'll be talking about thousands upon thousands of population with all the counties collected together. Do you know? Just to ask a question, or just one question. Sorry, have you done any studies in other countries, and the way it's done how is it done, or how you know, this multidisciplinary teams, how do they do it, or what way is it done?
So Deputy Mythen, just to say, like, what we're looking for the Southeast, we're not just as I say, it's the Southeast is not just a special case. These teams are up and running in other areas of the country across the border. As Eamon mentioned, in the Midwest, there's been a team running for over a decade. These teams work really well where they're up and running. And as I say, the Southeast is just an outlier at this stage. It's one of only 4 regions in the country that still hasn't been funded for a community neuro-rehabilitation team. And I know you asked why earlier, and it really is arbitrary. Because they're available, as I say, across the county borders in the Midwest of Ireland. There's been a team up and running for over a decade. The team's been promised since 2019. There's teams coming on board in other areas of the country. And as I say, it's just unfair at this stage that the Southeast hasn't got the team that was promised 6 years ago. And Senator Noonan, I know your sound cut off there. Did you want to come back in just with what you were saying? I'll just give you a chance to come back in. Thank you, Deputy Mythen.
I will, thanks. So hopefully that will stay. I left a message in the chat as well. But again, just to state that, first of all, thanks for the presentations. I'm more than happy to work with Southeast.
I think Senator Noonan's Zoom was cut out there again. We just can't hear him on sound, but I know he's popped a message there in chat offering to work with us. So folks, I'll just bring this meeting to a close just to say that we are going to be inviting all our elected representatives to join us for the launch of the NAI pre-budget submission in Boswell's Hotel next Tuesday, the 24th of June. We'll be calling on all elected representatives to join us at that meeting. We recorded this meeting today. We'll be sending it on to both to everybody who's attended and also to those elected representatives that weren't able to attend this morning. So if I can thank you all for your support, if I can especially thank Tom and Bernadette for their powerful testimonies this morning, and for all the NAI member groups and all the elected representatives locally who've come on board to listen to our message this morning that a team needs to be provided for the community neuro-rehabilitation team needs to be provided for the Southeast and funded in this year's budget to deliver on the commitment in the programme for government to complete the rollout of community neuro-rehabilitation teams. Thank you, everyone.